Welcome back. Joining us this morning is Dr. Ted Lain with Sanova Dermatology, and he's here to discuss adult acne.
That's right.
Dr. Lain, you're seeing a growing number of adult acne patients, right?
You know what? That's the fastest growing segment of acne sufferers that seek care in a dermatology office, is those adult women over the age of 18. And I think it's because there's a greater awareness of it. And there's such a greater awareness now that pharmaceutical companies are starting to address just specifically that population of acne sufferers.
What's different about women of that age group that's really causing them to experience some acne?
You know, we think it's the hormones. We think that there's just a greater relationship between the degree of acne and how it's being affected by the hormones in the body. And so, yes, we can start treating the hormones in particular, but of course we always want to combine that with a topical treatment as well. And so that's why I brought Altrino with me. So this is really the star of the show. There's a pharmaceutical company now that has developed a cream just for the adult acne sufferer. And in fact, it's a lotion, Retin-A, which has been around for a long time, but this has been reformulated to be really nice and elegant and cosmetic on the skin so that it doesn't cause a lot of the dryness and the irritation that you've seen with some
peeling and that red
that you've seen with some of the older preparations of Retin-A or tretinoin. Altrino really doesn't do that, so it's really groundbreaking in that way.
Wow. And you know, putting on a treatment isn't enough, right? You've got to do more.
That's exactly right. So I've tried to flesh out the whole regimen with some other products that women would use, both for cleansing, and I've given you an idea of a gentle cleanser here, a really nice cleanser with benzoyl peroxide as well, and then a lotion after that that includes a sunscreen, of course. And then at night, after you apply a thin layer of the Altrino at night, we have two different types of moisturizing lotions as well. So this really is a nice way to complement a prescription with over-the-counter skincare that is really effective.
One of the things you mentioned in one of those cleansers is it's the BP.
Yeah, the benzoyl peroxide.
Yes, and why is that important for women suffering from acne?
Not all women will be able to deal with that, okay? So it can cause some irritation and redness, but benzoyl peroxide has been around for 80+ years at this point, and it's just really one of the mainstays of treatment that we have for acne. And it works really well in the morning when you use a benzoyl peroxide cleanser with the Altrino at night, for example.
Okay, and you know, if someone is interested, maybe they have a little acne and they're like, okay, how can I get my hands on that magic lotion?
Yep.
Got to go to a doctor, right?
That's right. It is by prescription only.
Okay. But very kind of easy things that people can do if they're interested in helping their...
Really, it is. It's washing your face in the morning and at night, using a moisturizer after washing, and then, of course, you'll apply the Altrino with a moisturizer over that. So I really try and keep the regimen for people down to 2 or 3 steps morning and night. Really, that's all that people need to do, to be honest with you, to keep their skin clear and looking healthy. All
right, Dr. Ted Lain of Sanova Dermatology joining us. We certainly appreciate it.
Thank you so much.
We'll be right back.